Hi, okay, here I am, and I wanted to show you this other amazing machine that we have here. It's called the ATM2, Active Therapeutic Movement Machine, and it's made by a physical therapist out of Australia. This is a patient here. This is Chris. Now, Chris came in today, and he's got some bad neck pain. Chris, if we could, now I'm going to show you exactly what goes on with this type of machine. Now, this helps people with spinal stenosis, people with pain in their legs, back, arm, and neck, and shoulder pain, and so on. And it's helped dozens and dozens and dozens of people. But let's look at Chris today. So I wanted to bring you in on a day when I'm treating an actual patient in the office. Chris, you told me you've got neck pain?
Yes, I do.
Okay, now, which way does it hurt? Does it feel okay in any direction? Hurt some way?
It feels okay when I go left, but when I go right, it hurts.
It's stuck there. Okay.
Yeah.
Can you turn it either way, or is it okay?
I can turn it a little bit this way, but when I go to the right, it hurts.
It hurts?
It's very tight, yes.
Tight and stuck, okay. So what we're going to do right now is we're going to harness Chris into this machine. As you see, it just looks like these belts that come across the waist here, and it's just going to stabilize Chris against this Active Therapeutics machine. Now, Chris, if you look this arm, we're just going to put a band across, and the goal here is to stabilize the body, but over the shoulder. This was developed by a physical therapist who took all the top physical therapy strategies on treating patients with neck, back, shoulder, and hip pain. And this machine is like me having therapists at my fingertips to help work on Chris right now. Okay, so what we're doing right now is these bands are tightening against the body. Now these are pretty snug against you now, right? Okay, now does it feel any looser now, or does it still feel the same? So if you go to the side.
This side works okay. This is still tight.
That's tight. Okay. I'm going to tighten just this side a little bit. Now you'll see these cords will bring his shoulders backwards against the head that's behind him. Okay. Does that feel the same if you go to that's okay, but if you go to the right, is it the same or better?
It still hurts.
It still hurts. Okay. Let me switch to the other side now. I'm going to stabilize this shoulder backward, and it's going to immobilize the joint in the neck where the pain is. Does it feel better or the same?
It's a little bit better.
A little better?
A little bit better.
Okay. I'm going to tighten a little more. You can handle that, right?
Yes.
Can you do it any better, or is it the same?
It's a little bit better. I can move just a little bit more.
Okay. I'm going to tighten this side a little more now. Try it again. Okay, look at better. Look at that.
Yes, now I can move a lot better.
Can you still feel some pain in there?
It still feels tight, but the pain is a little bit better.
And when you started out, and it was a level, what would you call it before? Was it on a scale of 1 to 10, 10 is the worst?
A 9.
A 9.
When I went to the right.
And what does it feel? You're moving pretty good right now.
Yeah, it's like a 6 now.
Like a 6?
Yeah.
Can I tighten a little more in you?
Sure.
I'd like to get it down. I like to get patients down in one session within 2 minutes, and you're going to see what happens here. I like to get them down from an 8, 9, 10, all the way down to like a 2 or a 1. And it literally happens in front of my eyes all the time. All right. I know it's getting pretty tight, but try that again. How does that feel? Wow, look at that.
That feels much better.
Yeah?
Yes.
If you rate it again, is it from a 6? Is it?
It's about a 2 or 3.
Yeah?
Yeah, I can move my neck almost completely over.
Yeah, look at that. Okay. Okay, now what we're going to do is these isometric exercises with his neck, and that's going to work on what happened right now is his shoulders are retracted completely back, and it's stabilizing the joint in the neck where it's causing the problem, and we're going to be working on these muscles, the weak muscles around the injured joint, in order to make it stronger. All right, Chris, I'm just going to put my hands against the side of your head, push your head against my hand, push, and relax. Push again, relax, push again, relax. Again, relax, again, relax, one more time, again, relax. That's just it. Can you move your head again to the side? Look at that change. Look at that difference.
Yes, I can move it almost all the way now.
That's awesome.
That's good.
All right, that's good. All right, now I'm just going to loosen these up, release the pressure on them. Now this machine, this is constructed to work with shoulder problems, low back stenosis problems, hip problems, arm problems, neck problems. All right, one step off the machine and go ahead and move your neck now. How does it? Look at that
I
difference.
can move it all the way now.
That's pretty awesome.
That's great.
That's good. All right. Thank
That's
you.
really good.
Thank you.
Thank you.
You can stop that.